The Robert Wood Johnson Health Policy Fellowship and the fellows have been involved materially in every major health policy initiative that's gone on for the last half a century in the United States of America. When this program started, Medicare was not that old. But now we're kind of talking about, other issues like, structural changes kind of inside the healthcare system. How do we expand? I mean, these are new and different and important issues that, to me, are really exciting. And we've seen the fellows keep pace with that, and in many ways, kind of lead those dialogues on the Hill, in the executive branch, here.
I had enjoyed my work, one patient at a time, making a difference. But I found that after this experience, I found that I enjoyed getting involved with healthcare at a level that impacted populations of patients.
Health policy is a medicine and surgery for what ails the population. And physicians, nurses, other clinicians see one patient at a time. Honorable work, wonderful work. But if you have a chance to save an entire population with a single health policy, you should do it, because it's going to make you a superhero. And you won't look like a superhero, you won't have a cape, but you can change the direction of the battleship when you go after the right health policy. It's irresistible as a clinician to fix things for an entire population.
What the fellowship does is to really broaden your horizons a lot. And as you begin to think about the impact of a field that accounts for about 1/6 of GDP, you have to begin to think much more broadly. And harking back to Poor Richard's Almanac, an ounce of prevention is worth a pound of cure. So you start to think in much more public health terms of what are the things that we can do to prevent these things from having to be treated, as opposed to catching up on the back end. And those leadership positions matter because you can speak from with the credibility of somebody who has actually practiced, and at the same time bring into play the much broader perspective you gained as a result of what you were exposed to in the fellowship.
It's worth stating, if you don't mind, the importance of these kind of programs to not only inform health policy, but to inform the public discourse. I mean, the one thing that this health policy fellowship has had is the ability to see both sides of a problem and go towards a common solution. That's an increasingly rare skill. And for 50 years, this program has actually taught that, mentored that, and cherished that concept of what's good for the Commonwealth and how do we drive towards that.
When you have people who are clearly in the middle of healthcare delivery in many ways, physicians, nurses, other healthcare professionals who learn about the nature of the health policy process, both at the federal and state level, but of course at the federal level in that experience, they become much more effective in making the process more rational and less totally political. And it is those resources that the fellowship creates.
I'm an amateur gardener and I have a small vegetable plot. A number of weeks ago, I ripped up arugula that had gone to seed. And last week I discovered that I have a huge crop of baby arugula. That is an analogy for what I believe the Robert Wood Johnson Health Policy Fellowship has done for actual health of people. Over 50 years with, is it over 300? I believe it's over 300 fellows. It is very much like my arugula gone to seed. There has been so much seeding of institutions, advocacy groups, policy entities, legislatures, executive branches, the whole range of stakeholders in health that has been enriched by the experience of people who've done the Robert Wood Johnson Health Policy Fellowship, for which I say my sincere and fulsome thanks.